The New Orleans BioInnovation Center is a life science business incubator which brings together different resources in the development of life science companies. Today is a BioChallenge, a business plan competition that highlights some of our clients and tenants with the hope of really illustrating their own potential, but also the potential of the BioInnovation Center. Today you'll see several of our companies with different technologies, entrepreneurs with different backgrounds, and products that could make different but meaningful impacts on all of our lives. I wanted to highlight just a couple of facts to date here at the BioInnovation Center. We've helped in the creation of over 40 different companies. They range from 1 employee to 5 employees and a broad range of technologies. We have 28 tenants here in our facility, including the startups, capital companies, a clinical research organization, IP attorney, and a variety of consultants. So far, we have 60 to 80 different employees here in the tenant spaces, and we have a capacity of over 150 to 200. The one thing to keep in mind here is that we are a business incubator, which means that we will turn over these companies. As our tenants graduate from the facility, more companies will take their place, and so we'll just continue to enhance the local community. We've also formed partnerships with companies that really add value to the tenants and clients we have here. Those clients include, or those partners include, Jones Walker, Baker Donaldson, as well as other support companies such as the Downtown Development District and Cox Communications. We've also recently formed the BioFund, which is a $1.7 million capital source available to regional businesses as well as, or with a special focus on the life sciences. So what's next? Well, we're going to continue to help our universities expand their research base. Research is the foundation of what we do here. We'll continue to grow our life science community through programming and partnerships. We're going to especially look toward outside of our local community to national and international firms to bring them to the local market. We'll also continue to expand the economy by bringing more and more entrepreneurs and experienced management to the city. One of our great challenges would be qualified managers and employees that have a history in commercializing technologies, and it's very important that we bring more and more to the city. We also want to expand the opportunities for our local graduates. Everyone speaks about the brain drain. I think recently, especially, you'll see that more and more folks want to move to the city, so we need to make sure that there are opportunities for these folks as they move back. One note I wanted to make on this is that we have interns, we have fellows that we bring or we employ here at the BioInnovation Center. So far, we've brought together 23 different fellows and interns, 18 of which are still here in the community working for startups, some of our partners, as well as other folks here in the community. Finally, we want to help in the retention of these companies by expanding the business rationales, the way I put it, for them to stay here in the community. We want to attract more vendors to the city so we can add more and more value to the life sciences that we have here. But we also want to bring together more assets to the city where we basically eliminate the rationale for them to leave the community. Part of this is to bring other pieces together for commercialization and other facilities. One of the plans we have is to put together a graduation facility where more and more of these companies, as they grow, can expand into this building, into this new facility, so we won't lose them to other folks like the RTP in Boston and so forth.
It's great to be with all of you guys 1 year after we actually opened these doors, and many, many years after somebody had an idea to transform the economy in Louisiana from an economy that was based on extracting raw materials into a knowledge-based economy. That's the big idea. The state of Louisiana and its future is dependent on completely turning around its view of, number one, how it sees itself, how it acts, and how it's going to generate wealth going forward. We have a lot of natural resources in this state because of our geographic location, because of the oil and gas that we have under our land. We have done a great job. That's a very important industry. We need to keep doing that. But it helped us kind of lay down a little bit and basically begin to depend just on the extraction of raw materials and exporting those raw materials so that somebody else could add value to it someplace else. It's a valuable part of our economy. We need to keep doing that. Tourism, something that we all wanted to work towards, has now turned into a really great opportunity for us. We are now an international competitor in the tourism industry. It is a $5 billion industry. It provides about 80,000 jobs, and we continue to do that better than most people in the world. The Super Bowl is going to be another wonderful example. That's another piece of our economy that's important, and we need to keep that moving in the right direction too. But while we were doing those things and continuing to remain good at them, the world changed dramatically into a knowledge-based economy. And the state of Louisiana was a little bit slow either to realize that or to decide that not only did we want to be a part of it, but actually that we wanted to lead it. And so the idea now is to try to find a way to create new opportunities to add value to raw material, intellectual capital, and to creative talent. The example that I always use in terms of exporting everything that we have is Wynton Marsalis, one of our great talents, born and raised here, Patricia Clarkson, who will be with us tonight, Harry Connick, individuals who have as much talent as anybody in the world has it, but in order to do well, they exported their talent someplace else. Wynton Marsalis went up to New York. He took his talent and his vision up there. He added value to it there. He conceptualized jazz at Lincoln Center and found a way to capitalize a $1.1 billion project that created 3,000 jobs a year and provides economic opportunity for about 800 jobs. That could have been done here. And if we would have added the value here, we could have done that. Well, the same thing is true about our intellectual capital. The same thing is true about our raw material that we have. Instead of exporting it, the idea is to keep it here and to grow it here. And this BioInnovation Center, this incubator, is a personification of that philosophy. That's what's important about it. So as we set the table around the city, as we rebuild the University Medical Complex down the street, as we kind of work on the renovation to the Iberville housing development, as we reorganize downtown, we then have to have structures like this that give you the space to do the thing that we need, which is to add value to our intellectual capital. We set the table. Somebody has got to prepare the food. Somebody's got to put in the buildings what is important to take out of the buildings, and that's what this center is doing. And so it's really exciting to be sitting in front of all of you today to see that not only has it taken root, but it seems like we're flying high and we're flying fast, and that this plant, you know, this seed that we planted a couple of years ago is not only growing, but it's deeply rooted. And what you're doing here is nothing short of transforming New Orleans from being a city that got small and was shrinking into a city that is going to be tight, effective, robust, and be an engine for economic growth and development that's going to provide a quality of life for many, many, many years to come. So I wanted to come by this morning and, number one, congratulate you on your one-year anniversary, to give all of you young men and women here a big boost and say that the work that you're doing is really transformational. The city of New Orleans is in front of the nation's eyes, becoming its most immediate laboratory for innovation and change. And that is true whether we're talking about education, healthcare, housing, fighting crime, reorganizing government. We are, and you're in the process and being a critical part of actually transforming the way America actually sees herself and actually how societies completely recreate what it was that they were rising out of devastating losses. The people of New Orleans, and you're all a part of this, decided not to build back the city the way it was. We dared to dream about what it could become. And that's not just talk. You're physically sitting in the middle of it, and you all are a part of that taking root and actually coming into full bloom. So I want to congratulate all of you. I want to thank you for all the hard work that you've done. I know that it's been a huge sacrifice for everybody. Just kind of sticking with it and saying that we're going to stay rather than go, saying that I actually see the dream and I understand it, being able to put your blood, sweat, and tears into it, your money, your time, and your treasure is really just an unbelievable thing. It takes a lot of courage and a lot of vision, but it's a really exciting ride to be on, and I'm happy to be a part of it, and I thank all of you for everything that you've done. So God bless you, good luck to you, and I hope you guys do well. See you later.
So now for the main event, the pitch presentation competition. Today we have 5 companies selected as finalists for the Turner BioChallenge. We were really lucky to have a great panel of companies that we had to choose from around the city and the area, and I'm sure that the selection committee had a difficult choice in narrowing it down to the 5 teams that you'll see today.
Hi, I'm Ben Cappiello, co-founder of Bioceptive and the inventor of Bioceptive's core technology. Bioceptive is a women's health company that's developing patent-pending medical device platform for gynecological devices. Our first application we're going after is a new insertion device for IUDs, or intrauterine devices. The IUD is a small implanted device that gets inserted into a woman's uterus and stays in place for 5 to 10 years. It's one of the most effective methods of contraception. A recent study in New England Journal of Medicine said that it was 20 times more effective than the birth control pill. There are no user compliance issues with the device, which is why it's so attractive now. The issue with the with the IUD is not the IUD itself. It's more the issue with the insertion procedure, and this can lead to expulsions and perforations. These occur far too often and can lead to unintended pregnancies and also additional surgeries and malpractice. And the reason for this is this complex procedure. This procedure requires up to 5 different medical instruments, each one introducing more human error, each one introducing more pain for the woman. And really, the companies that are currently out there have only looked into improving this by improving this one part of the procedure, which is the current IUD inserters. What we did is take a look at the entire procedure and try and take a holistic approach to it and come up with a new way to insert IUDs. And that's where we've come up with our solution, which is one standalone device that replaces this whole procedure. Instead of using the sharp tongs of a cervical tenaculum to pierce the tissue of the cervix and pull on it, we use a gentle suction-based mechanism to make that attachment. Our goal is to make it so that any healthcare provider anywhere in the world can insert an IUD. And we do that basically, if you can make attachment to the cervix with suction and then squeeze a lever 6 times, you can insert an IUD. It's been that easy, and we've now shown that in our preclinical testing in cadavers. What does the market look like for this? There are currently 175 million women worldwide using IUDs. If we look at the most highly monetizable areas of that, mainly being the US and Western Europe, there's over 18 million users. The growth here has been outstanding. Since 2002, the annual growth rate of IUDs in the US has been 33%, and we've seen similar growth rates worldwide. This is a multi-billion-dollar market just for IUDs. Bayer Healthcare alone is doing over $750 million each year. So the opportunity here, of course, the first question everyone wants to know is, what does the regulatory pathway look like? How long does it take to actually get this to market where we can begin selling it? We are in an interesting situation here, being a delivery tool. We're not the IUD that gets implanted into the body. We're just the device that inserts it, that does the procedure. So we're looking at a Class 2 device for the FDA, Class 2A for a CE mark. This is a 3 to 5 month timeline for a CE mark. For the FDA 510K process, about 6 to 9 months. At that point, we then go and sell to physicians and to healthcare providers and really offer them an economic incentive to use our device. For current providers who are doing this, which is only 70% of OBGYNs are doing IUD insertions, we offer them the ability to reduce time, freeing them up to see more patients, and also save money by being able to reduce the number of tools that they have to buy for the procedure. There's also a huge part of the market that aren't doing IUD insertions, mainly primary care providers. We now offer them the ability to offer a lucrative procedure into their practice where they can make up to $300 on a 15-minute procedure. And for the current people in the IUD space, we really offer them an opportunity really to see us not as a competitor, but as a potential partner, and we see them as potential acquirers. We offer them the ability to expand their market and expand their sales to these additional providers. So who's our team that's working on this? As I mentioned, I'm Ben Cappiello. I'm a biomedical engineer from Tulane. Co-founded the company with Shuchi Kurata as a technology commercialization expert. We rounded out our management team by bringing in Dr. Stuart Davis, who has been a founder and executive of 6 different medical device startups, had 3 successful exits, including taking his last company public, Safe Stitch Medical. It was right after that he saw the same opportunity with Bioceptive and joined up with us. So currently, we've raised $385,000, which has brought us through 3 rounds of prototype iteration and through our first cadaver trial. We're raising a Series A round of $750,000. We have $500 of that already committed, and we're looking to round out that final $250 now. This will bring us out about 12 months, and will get us to our large milestone, which is FDA and CE mark approval. And really, part of the reason we're so passionate about this is not only is this a great business opportunity, but it's really an opportunity for us to make a real significant impact on women's health, both here in the US and Western Europe, where it is highly needed, but also in the developing world, where this is a very applicable technology. This is why we're so passionate about it. We hope to share that passion with you. So I thank you with that, and offer any questions. My name is Ben Cappiello. I'm the co-founder of Bioceptive and the inventor of our initial core technology. Bioceptive is a women's health company that's developing a novel patent-pending medical device platform for a variety of gynecological procedures. Our first application that we're going after is a new insertion device for our intrauterine devices, the IUD. The IUD is one of the most effective methods of contraception. It's well over 99% effective. It's 20 times more effective than the pill, but it's rife with errors that come about from its use, such as expulsions and perforations. And this is due to the complex procedure that's currently used to insert the IUD. So we've developed an all-in-one IUD insertion device that replaces the current 5 tools that are used in the procedure with one standalone device that doesn't draw any blood, that is transient, goes into the body for less than a minute to perform the whole procedure, and then is removed. Really reduce of adverse events from that occur because of the procedure, and also improve the outcomes from that. To date, we've done some extensive preclinical testing in cadavers, and are working to secure our second round of capital and to move towards our regulatory filings.
Next up is Billy Heim from Minivax.
Well, good morning. Thanks everyone for coming. My name is Billy Heim. As Jason said, I'm the Director of Operations with Minivax. I studied biomedical engineering at Tulane University and just finished my MBA in May. And so just to go into what Minivax is, our broad mission is to prevent and treat opportunistic infections, which are any infections that affect someone who becomes immunocompromised, whether it's by HIV or AIDS or organ transplants. There are many cases of opportunistic infection that can occur, and in particular, for us, we're focusing first on pneumocystis pneumonia, which is the #1 opportunistic infection, HIV and AIDS. And we're looking to develop therapeutics and vaccines as well as diagnostics for this serious condition. And just an overview of our strengths. We have a very experienced team with over 200 years of combined experience. We have a very strong technology, R&D, and proof of concept with strong IP presence, and we have many advantages over the current treatments, which are limited to antibiotics. So what's the problem? We've got pneumocystis pneumonia. If you hear about people dying from pneumonia related to a cancer, or it could potentially be pneumocystis. There are many forms of pneumonia. Pneumocystis is one that arises. It's the #1 opportunistic infection, HIV and AIDS, and like I said, it affects some of these other immunocompromised populations. But once diagnosed, there's a 20% mortality rate, and that's with the current standard of care of antibiotics. So the current treatments, antibiotics, you have limited efficacy, the high mortality rate still exists, there are many adverse reactions, and this causes switching from one form of antibiotic to another, and there's no prevention of future recurrence. So our solution is once you start here healthy, you become immunocompromised, whether it's HIV or going into chemotherapy for cancer or on corticosteroids, the potential for the pneumonia arises. It would be ideal at that point to go ahead and give a vaccine to prevent future onset of pneumocystis pneumonia. But if you already progress to the pneumonia, develop the infection, we would like to give you the an antibody therapeutic, which would provide immediate clearance of the pneumonia, your immune system would recover, and then we could potentially go ahead and give the vaccine after that to provide you with a healthy state and avoid the 20% mortality rate. We have a strong IP portfolio with multiple patents and provisional patents on our technologies. My name's Billy Heim, and I'm the Director of Operations for Minivax. I grew up in New Orleans. I went to Tulane University, did my undergrad there in biomedical engineering, then finished an MBA recently, started working with Minivax in about a year ago, and now, I've been working with them about a year. We're making pretty good progress, and Minivax, we're developing preventatives and therapeutics for opportunistic infections, and currently we're focused on pneumocystis pneumonia, which is #1 opportunistic infection, HIV and AIDS. So we're in the development process, optimizing our R&D and looking soon to start manufacturing the product and potentially get into clinical trials in about 2 years.
I'll tell you a little bit about ReactWell. ReactWell is a process and patented technology that allows to transport different types of platform technology. It allows you to get different types of feedstocks in into his reactor, and basically through this process and transform it into a drop-in synthetic transportation fuel, so crude oil, okay? Basically, you take a lot of wells just not performing, they've never performed, capped, they're just sitting out there, it's a liability. Through the process, we can take a lot of those wells and we can transform it into an asset, which is crude oil, okay? Basically, we take a look at the feedstocks, the platform technology, like I said. So you've got lignite, some different types of coal, some gas, even biomass. We put it through the process. It's an underground thermochemical reaction, liquefaction, okay? And then we can use the well systems, and then we can transport that into synthetic crude. I'm actually represent ReactWell, founded by Brandon Iglesias, and we're a biomass to liquid transportation fuels company.
What potential does that company have?
It has a potential basically to take any well that's been capped, any well that's not performing, and to basically turn that into an asset, and we can pop oil out of it again and keep it going forever. So think of an oil well that doesn't run out. We've got to rework it a little bit, but we can get it going for eternity and pump out crude oil that can be definitely sold to refiners and to brokers.
How'd you come up with the idea for this business?
Brandon is a chemical engineer from Tulane, and he has a large patent portfolio, and I think he just sees things in a way that he sees market opportunities, but the way he goes about transitioning that into an actual product is something that he thinks about things in a way that doesn't necessarily go with the industry trend, and I think that's where the added value coming from our company is. It's thinking about it a bit of an opposite way.
Next up is Voice HIT with Peter Ragusa.
What is Better Day Health is a 360-degree web-based health management platform that uses passive speech recognition collected in the background to transform provider documentation. It also uses home, mobile, and biometric device data monitoring for patients, and then collects all this data seamlessly and passively, again, in the background, and then uses that data to improve health, lower costs, and save lives. This is a bit of an animation that describes the process. So everyone in the clinic is RFID tagged. Patients can wear a little device like this. When the doctor walks in, their handset is activated in a hands-free way to collect the audio. That gets streamed up to Nuance. Nuance powers Siri, Watson, returns a text. That text is processed and sent along to Isabel for decision support. Isabel then returns the list of most likely diagnoses. So what the doctor sees is the most likely diagnoses for that patient's presentation teed up for them. What it also allows us to do is once they click that diagnosis, it then pre-populates the remainder of the documentation, thinking much like a physician does. Ultimately, they're able to close the encounter before the patient leaves the clinic. It removes the computer as a physical and emotional barrier between providers and patients, has broad implications in reducing staff across domains, and saves money while improving care. If we can save 1 hour a day for a family physician in Knoxville, Tennessee, this was $96,000 in net take-home per year, which is a significant increase. Dr. Peter Ragusa, Voice HIT, we are a web-based health management platform company, producing software that not only helps doctors to document encounters more efficiently, but also encourages patients to get involved in their care.
How'd you come up with the idea for this business?
It was essentially born out of my interest in technology as a child and medicine as I went to medical school, coupled with the policy knowledge that I had gained around health policy and the problems with the healthcare industry and the opportunities for innovative solutions to address a lot of those problems and help to lighten this overbearing burden of the cost in healthcare.
We'll now announce the winner of the first Turner BioChallenge here at the New Orleans BioInnovation Center. And that winning team is Bioceptive. Bob, will you come up? Congratulations, Bob.
Got the important stuff here.
There it is.
There's the important stuff. Just run this down to the bank.
surprised, but quite humbled. There are 5 real high-quality companies that presented today. All of us are in similar stages, some a little bit closer to commercialization than others. All of us have raised capital, have made some significant steps towards bringing our products to market, and everyone's going to make a great impact. So I was very humbled that we were chosen for this.
How many businesses have you been able to help in the time you've been open?
In the 2 or 3 years that we've been in existence, we've helped create over 40 different companies. In the year that we've been open, we have 28 tenants in the building, including some of those startups, as well as venture capital firms, attorneys, consultants, and so forth.
I think the program today was great. It was really informative. I think it gave everyone good exposure on what's going on here, and it was a good opportunity for us to tell everyone about our technology, especially for people from around the area who are not sure what's going on. It was great for the mayor to be here, and I think the event, I think it's a very good success.
Today's fantastic. It's the first anniversary of New Orleans BioInnovation Center. I was actually brought on as their entrepreneur in residence. That's how I met a number of these companies. I moved on to become a CEO of another company, but still work with Brandon as a consultant. And I think this is just representative today of the type of technology that's going to be coming out of here for the next 25 years. We just have to build a market cap to it.
I think it's a phenomenal program. NOBIC is a true resource for young startups in the New Orleans area, and it's a phenomenal resource for us to have.
What is your reaction to the work that is being done here at the New Orleans Biotech Center?
It's been incredible. It's been a great experience to be a part of this. The New Orleans hasn't historically been known for its biotechnology community, and it's been we're really starting to see it take off. We're starting to see these early stage companies that are really going to become the mainstays here, and are really going to help build that out. And there are now 25 companies here in the BioInnovation Center, and a number of them are doing very, very high impact work. So it's fun to be a part of that.
This isn't just a one-time thing. This is an ongoing program, and we really see the life science economy growing and growing as these businesses get on their feet, but also as the universities and other partners continue to grow their research base.
If people have questions or like more information, what should they do?
They should contact us at neworleansbio.com or through our local number, 504-680-2973.